Talk 640. WFNZ.
There you go. Go ahead. I'm sorry. I didn't have the song. I didn't have anything ready. You're on.
Kenny's doing his thing in studio.
I'm good.
Too. You're good? Okay. Well, on camera right now is Tamara Morris. You are the Deputy Director for the Cumberland County Public Health.
Yes, sir.
You're sitting in for Dr. Green, who, are we all hoping that she's coming back?
We're on a wing and a prayer. We're crossing our fingers, doing our extra wishes and things, but she has relocated, so we're doing the best we can in her absence.
Well, you guys are doing a great job, too. You know, and the thing is, public health goes on.
It goes on.
Radio station goes on.
That's it.
Everything goes on no matter who comes and goes.
Yep.
And so we appreciate you coming out. One reason we wanted to have you come out and talk this month, because you come the first of the month every month, is that we've had 2 rabies incidents, one in at Legacy Golf Course in Moore County, the other at Gates Ford Golf Course here in Cumberland County. And because of that, we had 2 people from out of town who were in the pro shops or wherever they might have been, and they could have been, it could have exposed others to the rabies.
Measles.
It is rabies, yeah, to me. We're talking about rabies. We'll get to that in a minute. The measles, by being in the pro shop or wherever it might be, been. First of all, it's been mid-March since that happened. No one has come to you and said, hey, we got anything here in Cumberland County?
Yeah, so we track suspected exposures as well as any confirmed cases, but we have not had a confirmed case in Cumberland County. That case that you're speaking of, that is individuals who were, they had another case in another county, and those individuals traveled here. So they were visitors at that golf course. And so we just needed to do our due diligence and put that information out to the public and let them know that if you were there, if you could have possibly come in contact, then this is the information that you need. These are the symptoms that you need to look out for. And then this is how you would proceed should you have symptoms and you need to get tested. First and foremost, don't just show up. Don't just show up at the health department. Don't just show up at your medical provider. Measles is one of those things that is highly contagious, and the contact tracing and quarantine period for it is very extensive. And so to protect others, to protect the healthcare providers, in order for them to screen properly, we ask that if you think that you may have been exposed or could be showing symptoms, that you call first. And our clinical supervisors will screen that call and give you next steps and guidance for that. But we haven't had any cases here. We're still doing our best to stay abreast of any of the information. The dashboard is updated weekly from the state. We get on those provider calls. We had an update yesterday. So we're doing our best to provide folks with information and provide them with opportunities to get vaccinated. That's your best defense at protection against measles. So we've got some opportunities coming up where we want to make sure that people have that availability as well.
You know, if you had your MMR years and years ago, like I did, and I'm 70, so I'm still good is what they said. And if I wanted to get a booster, I guess I could, wouldn't do any harm. But the fact is that vaccine has been proven 97% effective if you have it. So if you had that, you should be okay, even if you might have been in that area.
This is true.
Now, you talk about the incubation period, because it's pretty extensive, and it is hard to quarantine someone for that period of time.
Yes.
If they got to go to work or whatever it might be. And you made a point, I want you to emphasize this, about not walking into the health department somewhere else. If that's the case, if you think you have some symptoms, what should a person do?
Yeah, so if you think you've been exposed or you've been somewhere where they've put out contact lists, so the state will release information and say, hey, these are the locations where someone who has tested positive has been. If you feel like you've been in those places, this is what we need you to do next. If you have been to those locations, you can just call us. We've got the information on our website, on our measles link. If you look on the left grid, it'll show you measles. You can click there and find all of the information that you need to know about measles and how to contact us and what questions to ask. But you would need to call first, because we can ask the appropriate questions, give you the right information, and screen and let you know whether or not testing is needed. Because like you mentioned, if you've had that MMR vaccine, particularly had both doses, then your immunity is more than likely. So you may have been exposed, but not necessarily at risk for contracting the illness. We also have a period based on your exposure date that we need to count forward with. So for those individuals who may have been exposed, we ask that you count your symptoms for a certain number of days. And so we kind of want to make sure that we're getting the correct information and asking the right questions before you just show up, because it might not be necessary if
Well,
it was a certain time ago.
and I have the story here. As a matter of fact, they had one exposure March 11th between 7 a.m. and noon at Legacy Golf Course, Aberdeen. That's the one in Moore County. And then you had one on March 13th, a person who tested positive at Gates Four Country Golf and Country Club between 8 in the morning and 3:30 in the afternoon. And so the incubation period, if you've got to monitor yourself for 21 days.
So that would be if you were quarantining. If you were being required to be in isolation, you would need to do that for 21 days. And that's a long time. Like you mentioned, work, school, personal life. It's really hard. I know people remember the C word. we don't want to bring it into existence again. But COVID was a really hard period for folks to feel isolated and by themselves. And that's a really hard thing to do. But what we want to make sure that folks are doing if they've been exposed is if they're monitoring those symptoms for a certain period of time. So for individuals who may have been exposed at the golf course, the amount of days that you're going to be watching for those symptoms and looking out for rash and fever, those are the things that we'd be advising of when you call. So we got some calls from folks for information, and so we asked the appropriate questions. We have an educator who specializes in communicable disease prevention and education, and she is helping provide that screening. So she's that first line of defense in answering those calls. And if anything needs to be escalated to our epi team, then she does that. But like I said, thankfully, we have not had any active confirmed cases here in Cumberland County. We're really thankful to our residents from listening to shows like this and tuning in to the information that we put on our website and following through with those recommendations that we put forth. We are not the end all be all. We just rely on the evidence and from our other partners such as, CDC and Department of Health and Human Services, and the information and research that they've done that provides us with an accurate timeline for vaccine, a recommendation for immunization series. We have seen that to be effective, and so that is how we practice public health here in Cumberland County.
The thing about this, again, is the symptoms that are associated with the measles. I don't want to beat this down because we're going to talk about some other things, but the symptoms are very similar to
They mimic
common cold and everything like that.
Yeah.
So anyway, folks, be careful out there. If you think you have the symptoms, call the health department or your healthcare provider before you decide to walk in the room and expose everybody in the room as well.
Yep,
all right, look, you got some other things coming up here. This thing with vaccinations for the pets and rabies and people at the same time, but it's normally a pretty big deal. You got one coming up.
Yeah, so on April 18th, on that Saturday, we're going to have our Vax Your Pet, Vax Yourself event. We do this 2 times a year typically, in the spring and the fall. And so this is our opportunity to provide a rabies clinic to community. So you want to vax yourself, but you want to vax your furry friends as well. So that's an opportunity to get that required rabies vaccine for cats and dogs. We offer that at $5, cash only. Requesting that you bring exact change and no coins. But we start at 9 a.m. and run through noon. A local vet is able to partner with us and to provide those. And that is legally required for you to have your pets vaccinated. And so for you to be in compliance and get that 3-year rabies vaccine, we provide this outreach clinic once a year. And then the Vax Yourself part is that you can come utilize our immunizations clinic. So for those that need that MMR vaccine for their little ones, if you still need RSV or COVID, that's an opportunity to get those boosters or other vaccines that you need. And we've worked really hard and are thankful to our county commissioners to be able to keep those available COVID vaccines for free. And so we are providing that opportunity at the Vax Your Pet, Vax Yourself event on the 18th. And we're going to stay open for the Vax Yourself part an hour later. So that part will shut off at 1 instead of noon, because we know the school year hasn't ended yet, but some of y'all want to get a head start on that back to school vaccination as well. And so back to school immunizations are going to be available at the event at no cost, no appointments required. Walk-ins are available the entire time. But those back to school vaccinations are required. So if you have a rising kindergartner, rising 7th grader, or rising 12th grader, there's a certain series of vaccines that are required for them to go to school. And so this is just an early start for you to get a head start on the summer and next school year to get those little ones the vaccines that they need. So 9 to 12 for the rabies clinic, and our STD Express clinic will be open at that time, so you can test yourself as well. And then the Vax Yourself part will be 9 to 1 at 1235 Ramsey Street. So we hope to see you there.
Okay, well, Tamara Morris, the Deputy Director for the Cumberland County Public Health Department, we appreciate you coming in and sharing
Always
that
a pleasure.
information. And again, you got those events that are coming up. If you weren't able to jot down the dates and times, you can go to the website or call the health department. I'm sure you'll be able to get all the information you need about these events.
That's right.
All right, thank you so much. You're listening to News Talk 640 WFNC. We got local news right now.
A woman has died after being injured in a fire in Fayetteville Wednesday afternoon. The Fayetteville Police Department and EMS personnel responded to a call at a home being on fire in the 1700 block of Empress Lane. This happened just after 2:30 p.m. When crews arrived, they found the home in flames. They began to put out the fire. Police department said a man escaped the home through a window with no injuries. Then when fire crews entered the home, they found that woman who was injured.
It is another warm start to the morning and will stay warm with a high of 85 and partly cloudy skies. Overnight will be partly cloudy with a low of 61, and Friday will also be partly cloudy and mainly dry, but an isolated shower can't be ruled out, and we will also have a high of 84. The holiday weekend is expected to stay warm, but rain is expected to arrive by Sunday afternoon and then continue overnight due to a cold front, and it will bring back cooler conditions next week. That's your Fayetteville forecast. I'm CBS 17 meteorologist Rachel Dunsing.
All right, Rachel, thank you so much. Right now, 64 across the board.